Welcome to the Chief Healthcare Officer podcast. I'm your host, Dr. Fatih Mehmet Gül, and today I have someone very dear and very important for me from Chicago. He is Scott Becker, a founder and publisher of Becker's Healthcare. It's an honor having you here, Scott. Thanks for your time and thanks for joining me today.
Well, Dr. Fadi, the honor is mine, and thank you for having me on, and so excited to get to visit with you and share perspectives, and I'm very excited to be with you. Thank you.
It's my pleasure, sir. Um, we were just having the chit chat just before the recording, and as I told you, I have been following Becker's Healthcare since 2005, and I can say that I grew together with Becker's Healthcare, and it has a very special place for me. But just before we start, most of the followers of this episode, I'm sure maybe first time they're hearing about the Becker's Healthcare and first time they're seeing you. Let's start from your personal journey first. You are coming from Harvard Law, you're an attorney, then later on, you are a healthcare thought leadership today and helping us to understand the healthcare better, showing us what the real healthcare issue is. Can you just introduce the journey a bit to the followers before we start the discussion?
Sure. Well, no, thank you so much for having me. Yeah, so I started Becker's Healthcare now about 32 years or so ago, and it's easy for me to date it because it goes with, when our 31st or 32nd annual surgery center meeting, which is one area that we're in. The company itself is our core area is what you think of as hospitals and health systems is the big ad audience, the big area. The second largest area we focus in is health information technology and all things related to it. But the core of the company today, we're involved in a number of different specialties outside of hospitals, health systems, but hospitals and health systems. And really, we focus largely on the United States system, which is great and challenging. It has good things and bad things, like many other systems throughout the world. And we do some thinking about other systems too, but our core is U.S. healthcare. But we'll hopefully use that as an analog for what people see in other parts of the world too. I started it as a really an effort to be, and this is 30 plus years ago, what people think of. I was a lawyer trying to build a legal practice. I was trying to be thought of as what you think of today as a thought leader in healthcare, as building a law practice around the healthcare area, not malpractice, around things like corporate and business and what systems are doing and what hospitals are doing. And I was trying to build this really a legal practice as a thought leader. And as we got started in it, and this goes back a long time ago, I had started a really small newsletter, a really small conference. And if you fast forward 30 years later, like for example, our conference this week, John McEnroe spoke at, the famous tennis commentator. We've got a conference coming up where Wayne Gretzky is speaking, the famous hockey player, Jack Nicklaus, the famous golfer. Caitlin Clark, who's a basketball player, but has become a phenom here. And then also we've had people speak like Bill and Hillary Clinton, George Bush. A number of former presidents have joined us at the conferences to speak and talk about leadership and what they see. But started it 30 plus years ago to be a thought leader in healthcare. And at some point, about 8 to 10 years later, got much more serious about turning that into a media company that really covers healthcare. And so that was the effort. We were digital first. We were early on in trying to be well read and listened to digitally. And then we were early on pretty big in events. So we've got our CEO conference coming up in a couple weeks, or next week. It starts Monday the 3rd. And that has hundreds and hundreds of the top CEOs in the country at the event of the big health systems. And so we ended up really building a media company around connectivity, digital, meaning websites, digital newsletters, and so forth. We have a print newsletter, but the world of print has changed so dramatically. It's a very small part of what we do. And then we have these nice size events, a lot of them around
Yeah,
hospitals and health systems.
I have friends from US. I mean, when they have their piece published in your website or in your newsletter, they always send this to me saying that, Fatih, look, in Becker's, my piece has been published. That's the first thing. The second thing, from time to time, I receive a call from folks and emails. Oh, you know what? I have been added again this year in the ranking on the Becker's Healthcare. I feel amazing about it. So you are not just, teaching people, you are also empowering the leaderships over there in US with such touching points, I guess.
Well, we try and do a lot of what you try and do is to teach and entertain and provide a network and an opportunity for people to talk with each other. Didactic learning, it's not that didactic learning is dead, but people do so much better in the learning when they can interact with others, see the content and frame it in their own voice, their own thinking and so forth. And so it's a lot of like trying to develop what you develop, which is the back and forth people talking to each other, and we have to have critical mass to have the right people that they want to be there, that they can interact with each other because our whole team, our whole people really learn from each other, not from us. I mean, that's really the so much of the conference world and even the digital world. Comments are so important until they get ugly and ridiculous, but people having a chance to interact is so important. And so we try and create that forum, that opportunity. And we're very focused on the areas that we're focused on to try and make sure we're not doing everything for everybody, but we're very focused on the health system leadership and then a handful of other niches. And we love it. It's given me a chance to meet with and visit with so many different people, including yourself. I mean, it's a great
My
pleasure
pleasure.
to be,
My
you know,
pleasure.
to,
My pleasure. We are really learning from these interactions. And then I know that one thing is very important for you. I just want to shift to this part. You always tell us how people are important, and you always emphasize them, and you always put the people's stories at the front. So I just want to, ask you. You have been observing all the healthcare technology changes. I'm sure there were so many technologies in 1990s, and technology evolved, moved to another part in 2010, and the COVID time, and now, and it will continue to evolve. But people part will never change. Let's touch to the people part because you are empowering the people with such, touches to leaders to others. Can you just tell us more about how you see the people part in healthcare operations? And so many leaders and healthcare professionals are listening. And what is your advice from the people part, people management part?
Sure. So we talk about this often because we think in healthcare we've got a horrendously challenging supply and demand problem. Meaning, and I look at it in any country, quite frankly. I mean, some nations in the world are really understaffed for the amount of people that they have, and it's an impossible challenge. I mean, if you're looking at a place like China or India, they each have 1.5 billion people. They are at the end of the day, when you talk about multi-tier health systems, they're just so understaffed from a doctor and nurse standpoint that it creates tremendous problems. In the United States, the third most populated country in the world, we are moving in that direction. And the rest of the world might have little empathy for us. We're so used to being well staffed that we're not used to having the numbers of doctors per capita go in the wrong direction and challenges with access and so forth and so on. But we're quickly moving in that direction of just horrendous supply and demand indifferences. We view it as a very big math problem. Now, people say technology, preventive care, GLP-1s, and so forth will solve that problem, and we tend to disagree. We think at the end of the day, we use the phrase trust and verify a lot. Trust but verify a lot. So we trust that technology, prevention, GLP-1s are all really good things, that they'll add to the equation, they'll help. But at the same time, the supply of labor, both physicians and nurses, is so critical. We've moved to a spot where we're down to about 1 million practicing physicians for 345 million people in our country. There are so many places in our country where there's, for example, one neurologist for 500,000 or 1 million people at a time when dementia and Alzheimer's is exploding in terms of diagnostic and neurological problems, where there's one dermatologist for several 100,000 people in an area where skin cancer is very, very explosively accelerating and growing. And so we view this as, when I think about this, I think that everything in the long term is people plus technology. It's not one or the other. It's trust that technology and prevention will help, but it's technology, prevention plus people, plus the labor supply. Our country ends up, in obviously lots of pros and cons to our political system. but we end up often politically deadlocked. So we know that we have to add more residency spots so that more people can go to med school. We can get the best and brightest to med school, but then through to residency spots, but we don't have enough residency spots. So we're sort of limited in creating more physicians right now. We have 10,000 physicians retire a year, 25,000 new physicians become physicians a year. But the ratio compared to our population is going very much in the wrong direction. And that's the same throughout lots of parts in the world. We obviously have done a great job traditionally in having great immigrant doctors come to the US, and that's obviously a great thing for our healthcare system, but it also is somewhat of a zero-sum game because if we take physicians from other great countries, now there's less physicians in those countries. So we need to figure out how to expedite, improve, accelerate medical education. They do it in other parts of the world faster and just as well as we do it in the US. They do it faster and they produce just as good of doctors. So from a US perspective, we need to figure out more of those models where people are becoming practicing physicians and truly outworking by 26, 27, 28 versus what we now have in our country, which is 30, 31, 32. And it's a debacle. A lot of it is a self-inflicted error because we could fix this. We fix it in the nursing staffing area. We need to fix it in the doctor staffing area. And Vadi, I didn't mean to go so long, but I hope that's helpful for context. That's how we view that.
That's very much helpful. I mean, the shortage is a problem. And then, as you just said, I'm managing large hospitals. And then every day I receive my nurses coming saying that, oh, I received an offer from US, from Canada, from other places. Shortage is an issue. Yes, shortage looks like a problem of the Western countries. As you just said, by pulling people from the other countries, it will be the problem for all of us. But one point where I want to touch when we have such diversified teams, today, Scott, in our hospitals, we celebrate Christmas, we celebrate Eid, we celebrate Passover, we celebrate Diwali. Why? Because we want all these kind of people to feel at home, and then we just want to bring them all around together. So, what is your advice to the healthcare leaders for at least retaining people? Yes, shortage is a problem. So then the employee engagement is becoming more and more important. And in Becker's Healthcare, you always put the people stories over there, showing how important the people we have. So I just want to hear your advice about this and your observation, what happened for years about the people engagement.
Sure. No, I think there's multiple different pieces of that. It's a great, great question. I think there's at least three or four things you have to do right to keep people and retain people. First you have to pay them, and it's not the most important thing. You need to pay them fairly. Nobody comes in. Most people don't come in and say they need every last penny, every last dollar, but they need to be paid fairly. And my thought on compensation is that you can't have people coming in every morning irritated about how they're paid. So it's not the be all and end all. You can't pay people enough to keep them in a bad environment, but you have to pay them so they don't come in the door irritated every morning. So that's sort of just one piece of it, and there's three pieces of it. The second is you have to have enough capacity of people. And the reason why that's so important is you could do all the things you want about physician wellness, nurse wellness, staff wellness, but if you don't have capacity to give people time to breathe and to take some time and to not be just in the trenches every moment, they can't withstand it. It's just a prescription for burnout. So you can't, you could do all the cute things you want, like they have in certain hospitals, the spa in the hospital, the this in the hospital, all these things that are nice things, the garden in the hospital. But if people are overwhelmed because there's not enough capacity and talent, then you can't keep people happy. So capacity, you need, everybody talks about just-in-time inventory and running lean, but you need enough slack in the system so that people could breathe and relax a little bit. So that's the second thing. The third thing is you need a culture slash mission, something that people could feel good about what they're doing. And it doesn't have to be perfect, but we talk about in all of our organizations what we call a thrive culture. So I can thrive, but I can't thrive at the expense of another key part of our team. We all have to thrive. And it means that, there's not this, we view the world in a Venn diagram, meaning where's the overlap? So somebody's professional life doesn't have to be perfectly aligned with the health system. They don't have to be perfectly aligned with the company. They've got to be aligned enough that there's a great overlap. What they love to do is what the system or the health system needs them to do, but it doesn't have to be 100%. The other concept that we talk about a lot, and I'll stop in a second, Dr. Vadi, is we talk about this concept of loving your 90 percenters and a gratitude culture. And I think this is very important. And I only comment it because we've seen it so many times over the years. But when somebody that works with us does 90% of their job great, 90% of their job great, I need our supervisors, our team members, our people loving that person for that 92%. Love your 90 percenters. I can't have them. And I see so much this where we've got a boss or a leader that can't help but focus on that 7 to 8% that that person's not great at. And we need to build an organization where as long as they're great at their 90%, we have to love them and be thrilled with them and embrace them and almost ignore that 8% unless they want to fix that 8%, unless that 8% is really important to what we do. So we have this concept of
Great point.
money's got to be fair, culture's got to be good, there's got to be enough slack in it, and you got to have this culture and thought, and it goes hand in hand with some of the things we've said already of gratitude
Great.
and
Great
loving your
recommendation.
90 percenters. So
Because
we view it a lot like that.
you keep meeting with the large health system leaders, and I really love the way how you have summarized this one, and that's definitely what all we're trying to follow. And also, I think we can bring some technology elements for leaders to manage, because when also we look at the leaders' difficulty before. 20 years ago, a hospital with 1,000 staff was something big. Now there are hospitals which has 15,000 people, 20,000 people, and it's not easy to manage all these people. And I'm about to finish my book, and over there, I'm just writing how leaders can use technology to increase the engagement with their people. So, from this point, let me just shift to the technology part. You're also following all the trends in healthcare technology, and you're seeing now new trends happening, AI, and Epic is simply jumping on everything, and then they run everything themselves. How do you see the current technology trends in the healthcare landscape, and where do you see it's moving forward? Do you think these kind of technology things will help caregivers and hospitals, and then will relieve the load, or this will add another load on top?
Right. No, it's a multifaceted question, obviously, and a great question. In terms of one, as you adopt new technologies, you need to be selective and careful to make sure your capacity, the people's capacity in your system, can embrace and work with those technologies. That's one. The second thing on the technologies, and there's so many technologies, and we'll touch on them in a second, whether from telehealth to predictive analytics to ambient listening to voice types of work that work with the patient or the revenue cycle directly. So many different technologies out there. The second thing I'll say, besides having enough capacity for your team to take on the technology without being overwhelmed, you need to make sure the technology is relatively easy to work with and relatively quickly for people to adapt and embrace because very quickly, and a lot of it's due to burnout, to exhaustion, and so forth. If something takes a team or a physician or a nurse or an administrative person a long time to get comfortable with, then they just can't, they won't use it. They won't stick to it. So that's the second thing. The third thing is in terms of AI, in terms of technology, it's a constant evolution and it's a constant sort of over a 2 to 5 year period. We'll really see where the technology is the most impactful, where it has the biggest help, whether it relieves burden or not. Certainly currently the hottest thing that's becoming a necessity is ambient listening technologies in systems, whether it's companies like a Bridge or Ambience or others that are really allowing physicians to have so many of the notes taken while they're doing their visit with the patient, so they don't have to then stay up at night doing notes and so forth. That it's being done, automatically in the room And those are big evolutions. I mean, you've got, and I think what happens is you look at AI, we talk about this concept of looking at 2x versus 10x solutions. So a 2x solution, simplistically, telehealth is a great example of a 2x solution. It leverages a physician to give that physician more time and more space. And that's obviously very helpful. It means the physician doesn't have to be in their office all the time doing stuff. He or she could do it remotely in different ways. But that doesn't replace the need for a physician or really reduce physician time, and particularly how it's managed for a period of time. It could add more time versus less time. So there's leveraging solutions. And then there's what we think of as 10x solutions, where you'll have a technology solution and we're not there yet. At least on the clinical side, we're not really there yet. It'll remove the need for a physician to interact with the person, or remove the physician need. And we're still a distance away from that in most places, getting closer in some primary care diagnoses versus specialist diagnoses. But I think I mean, the reality is we're going to look at this over a 2 to 5 year, 10-year time period to see what really has big impact and what doesn't. There's obviously things that are already sort of what I think of as tried and true and improving. A lot of predictive analytics, a lot of telehealth, a lot of robotic surgery, which doesn't replace the surgeon, but makes the surgeon's job better or better able to provide surgery.
Exactly.
There's lots of stuff in the AI revenue cycle world that really has replaced the need for a lot of people that were very hard to staff to begin with. So we've already seen it in some of the administrative sides. On the clinical side, we've still got some distance to get to where we
You
really.
just touched to the point about technology plus people. I hope all these solutions will evolve in this, approach. So then we will still keep some human touch, and then we will be able to get the best benefit out of it. I was talking to Dr. Peter Bonis, the founder of UpToDate, and then we had a wonderful chat as we are having with you. And I asked him the same question. He has the solution UpToDate, and he is giving this to the clinicians as a pathway solution. And at that time, I was asking him if UpToDate will also get some AI solutions. And a month later, now they introduced their AI solutions and other kind of thing. So, shall we expect something from Becker's Healthcare about AI solutions and something coming up?
That's a great question. It's not, we're constantly looking at ways throughout the organization to implement AI. And there's so many, like, and what happens with a lot of these things is organizations, there's systems testing and there's individual testing, and they're very different things. But from an individual testing perspective, I gave a speech last week in Miami. I had an outline for the speech, and then you take the speech and you say to ChatGPT, can you turn this into an article? And it essentially does in literally 2 minutes turns it into an article that I still might need one of my teammates or myself to edit, but it's just night and day from what that was 5, 10, 15 years ago. It's like, I've worked with one of the AI solutions that it's constantly saying, do you want it in your voice? Do you not want it in your voice? How do you want it? So I think it's an evolution as organizations and as people. But I think what happens is you get to this information overload world. And this is the other side of this take, Fadi, and why these kinds of conversations are such a pleasure and so important. And well, I don't know if they're important for anybody but me, but they're important for me in that this connectivity, this human connectivity, as you get into this information overload world, we view one of the core goals of Becker's Healthcare is to maintain that personal connectivity with our health system audience, with the people we work with, and so forth, because you try and hit this right balance of real, like, having a chance to be on the phone with you, even if we're on Zoom versus in person. It gives me a chance. I've seen your name now for years, and now I get to see you in person and connect with you. I get to work with your producer arm, and just it's a great pleasure to have. It's just a different level of connectivity. So it's trying to hit that balance. But even for
Thank you.
things like this, I record a ton of podcasts a day. More and more, I'll say to ChatGPT, "Hey, can you give me several questions for this?" And then it's like all of our moderators at conferences, we get criticized as moderators when we just stick to rote questions and don't lean into the conversation. You know,
Yes.
and then we get criticized when when the moderator speaks too much, is us as moderators, and so trying to both combine that use of the AI with with the personal interaction and touch. And another place we use it is we have we have a number of people that are event producers at our company, conference producers at our company, and at our next CEO event over a 4-day period, I'll moderate, I think, 10 or 11 sessions, and all very important in their own way. And it used to take somebody a very long time to draft questions for those 10 to 15 sessions.
Yeah, before you're right. Now in
Now
2 minutes.
literally, and the drafts are sort of, are they good enough? Yeah, they really are. They're very close to what we'd be asking
Amazing.
anyways. And it's not about the questions, it's about having the discussion with somebody. So there's a
True,
lot of
true.
different ways in which we're saving time, and then trying to figure out how we do that and really stay deeply connected with our audience is the great
Amazing.
challenge. Because yeah.
Amazing. And I mean, I think here we're touching to the authenticity point. I mean, if it is from you, from your hand, it is more authentic still rather than working with the machine and then creating this. When it comes to the authenticity, another point which is still authentic, what I believe, is writing a book. And you have a book. It is The Edge, the entrepreneurship book. And there are so many clinicians, doctors, nurses, they're all trying to jump to the entrepreneurship side and they're trying to learn. So maybe you can just tell us something more from your book to show them the right venue. And also, you can tell us why you wrote a book like that one. So I would love to
Sure.
also touch to your book point too.
No, thank you so much. So we wrote a book called The Entrepreneur's Edge, and it's got some subtitle to it. I don't remember right now. But then we also have another book coming out in May of next year about building businesses. So thank you so much for asking, Fadi. Thank you, Dr. Fadi. So yeah, we think about business in, you know, we try and simplify constantly. So we think of it about building great teams of people, serving a real niche, uh, product market fit, and ultimately taking great care of your customers and your people. We try and constantly simplify it, and we do see, businesses going great, and it's challenging. It's how we view it. It's like the American health system. It's going great, but it's also really challenging in certain spots. And I think business is the same. You're trying to figure out niches, and you're trying to figure out the right people and putting them in the right place for success. And you're trying to make sure you hit product market fit, that whatever you're doing, somebody really wants, that somebody really wants what we're doing. And I think it's a constant challenge, a constant evolution. There's no way around for most of us testing, and testing and repeating and testing and figure out what works. And then we come back to this concept of really knowing your own business. And I know I'm just talking a lot right now, knowing who your most important customers are, knowing where your revenues and profits come from, and really taking care of those people.
No, I
Certainly.
really appreciate. I really appreciate, and I mean, I want this book to be the book like the Good to Great for our healthcare leaders. And I mean, I
Uh,
have your book. I really enjoyed it. It is in my office, and you're touching to the people point over there. You're telling how important hiring the initial people, at least for the business, and retaining them.
yes.
I love it. I mean, having the right people on the bus, right? That's the same thing, and we have to just bring it to today's business.
100%. No, we agree with it fully, and I've done both. I've had plenty of business successes, plenty of business failures, and every time that I've succeeded, it has started with building a great team around a great market, around a great niche, something that people want to do. Where I've not succeeded is where I've been too lazy to build a serious team, or didn't want to invest in it, didn't want the headache, stuff like that. But it's very hard. There's a great concept. Somebody used it the other day. There are no best-selling authors, there are best-selling teams, because you need a team to help market a book, or whatever you're doing in life. It really ends up being around teams. I mean, the great entrepreneurs of our time, people talk about them heroically, whether it's Jensen Huang, or Mark Zuckerberg, or Elon Musk, or Stephen Jobs, or Bill Gates. The real trick is none of them did it alone. Lots of great teammates, and their great strength is, you talked about earlier, and I love this, about when you had a 1,000-person hospital, you knew everybody, at least close to knew everybody, within a person or two. Now people are running systems with 50,000 people, 100,000 people, and no matter how much they broadly communicate through a microphone or through whatever, they can't really touch everybody in the same way. They could try, but the most important thing a leader of a big system does is hires his 15 or her 15 people that work with him or her to lead the system.
Exactly.
That's the most important thing. I mean, you just can't, there are no great shallow teams.
I agree. I fully agree. Now, I mean, I just want to get closer to the closure of the episode. You have a daughter, I have a daughter, and then I follow them, and they are completely new generation. The expectations, what they have, is completely different than our young ages. The way how they live is different. So then, the customer landscape is changing dramatically. I mean, if you sell something to our mid 20s something, they will never buy it. They will say that, oh, awkward, and that they will simply ignore. So then our leaders, healthcare leaders, now having difficulty to, I mean, somehow get the way through and then understand their needs. Now, just before we close, I want you to guide them, to give them some advice. What do you think healthcare leaders should do to bring the healthcare services today at the level of this new, difficult generation's expectations?
Yeah, no, it's a great question. We had and it makes me think, it's so funny. We were with two of the daughters were with us this weekend with Liz and I were together, and two of them are in grad school working really hard. One's at medical school, one's in grad school in international affairs, and she's the one who spent the last year in Jordan. And so it's fascinating for me to watch the the kids in their perspectives, and it comes back to leadership. And leadership is, if you're a leader of a large system today, you know, you have to have multi-generational teams. There's just no way around this. It's sort of like, so I like when I would tell my kids years ago, that I forget what they were telling me about people making money on YouTube and TikTok. And I said, there's no way people are going to make money on YouTube or TikTok. And of course, I'm from a different generation. And of course, they're like, no, people make a lot of money on YouTube and TikTok. And I was like, that can't be right. This goes back years ago, years. And of course, they were right. I was wrong. It just, your vision is just so narrow and you can't help yourself. And you're never going to be, none of us are ever going to be perfectly intelligent, perfectly this, perfectly knowledgeable about everything. We're going to, at best, be able to understand what we know and what we don't know and be able to build teams to deal with it. At one point, I've been in the media business for 30 plus years, so that ages me itself. But at one point, I was managing people that were in their early 20s directly. And if I try and manage those people directly today, one, I don't have the patience for that, and they don't have the patience for me. So it works out okay. It's not in a bad way. They're like, "What is that old guy talking about?" And it's like, and the reality is I'm not when you talk about the 1,000-person organization versus the 5,000, the 20,000 person organization. And it's such an important point because there's this great concept on tribes that the old days, the tribe was 150, and that was about the maximum that you could have a tribe and be really close to people and really touch people and really connect to everybody and so forth. And of course, as civilization has grown, we no longer have tribes of 150. So you need to leverage yourself. You need to have great people you're working with. They got to be able to manage different teams and so forth and so on. So everything comes back to building teams and building multi-generational teams. Um, you know,
Exactly.
a-
And
a- a- a-
and we recommend leaders actually to try to understand this next generation, listen them, and then I mean, you also often touch to the point of to be likable and to be respected at the same time. And I think now the leaders should look at this part using the technology and get ready to manage these large crowds. Otherwise, our business is people business. I mean, we have to manage people, then they have to manage the patients people, and we have to provide the best service. Otherwise, it will not work. We don't have the machineries.
exactly. No, I love that point you pick up on liked and respected. If you went back a generation ago, people would have answered that question. I just love that point, and we talk about that often. So thank you, Dr. Fadi. People used to talk about being, is it more important to be respected or liked? And so if you went back in leadership 20 years ago, universally, people would have almost always said it's more important to be respected. And it was a different world, a different time. Now it's very important to be, quite frankly, both. And it doesn't mean you have to be best friends with everybody, but people got to think and believe, and it's got to be true that you should care about people in your organization, in your teams, and so forth. And you also have to be good at what you do. You have to be both respected and liked. It's much harder for leadership. A leader at one point, maybe,
Exactly.
just very different styles of leadership than we have today.
Exactly. And that's why we expect leaders to use all these platforms, all this technology to reach out. It's like politicians, like the mayors of the small towns, right? You have to be ready to manage all these people, and you have to be politician. You have to be active on media. That's why you're doing an amazing job, Scott, and you're amplifying the voice of the healthcare leaders. I really appreciate. I want to thank you on behalf of all these healthcare leaders, and I hope my followers will also tap into the Becker's Healthcare, which I start my every single day with it. And I'm sure they will also enjoy reading all this stuff what you produce.
Well, thank you so much. It's such an absolute pleasure to be with you today. I am so glad we got to do this, Dr. Fadi. Thank you so much for having me on. Thank you.
Thank you so much. Thanks, my listeners. Thanks joining us today. And then we will have so many other great guests, and we will continue covering the leadership, healthcare, and all the trends together. Thank you so much for you listening us today. Thank you.